Hello students, welcome to this session of practical stool examination. Now let's study indications of examination of stool. So first, it is required for the detection of parasites, infestation of intestine like hookworm, roundworm, Entabbima histolytica, which causes amoebic dysentery. Then bacterial infection of intestine studied by cultural examination of stool like bacillary dysentery, which caused by Shigella, enteric fever, cholera. Then chemical examination of stool is done to detect defect in absorption, that is malabsorption syndrome. Urobilinogen estimation to study excessive hemolysis. Occult blood test is done for detection of ulcerative lesions of upper gastrointestinal tract. For lab diagnosis of parasitic infection, the specimen is stool and it is done for detection of ova, cysts, tropozoites, eggs, larvae of the parasites. So collection of sample is done by either direct stool examination or other samples can be NIH swab, that is National Institute of Health, is used to collect samples from the perianal area in the infection of enterobius infection. Then cellophane tape is applied to the perianal area of the patient early in the morning, or string test for duodenal samples for tropozoites of Giardia lamblia. So these are different methods of the sample collection of the stool. Then after that, stool preservation can be done in polyvinyl alcohol, merthiolate iodine, Shodin fixative, or formalin solution. So this is a stool container. In that plastic container, sterile container with the spoon attached to the lid of the container. Now when to examine the stool sample? So if consistency is liquid stool, then you have to examine it within 30 minutes, because in that we are examining tropozoites, that is motility of the parasites. So tropozoites like amoeba or giardia. Then semi-solid stool we can examine within 1 hour, and solid stools of formed stools up to 24 hours after collection, because in that we see mainly cyst forms. In semi-solid we can see both tropozoite and cyst form. The first step is macroscopic examination of stool. So consistency of stool, like it is liquid, semi-solid or solid. Then blood or mucus present or absent. Then few parts of the intestinal parasites like adult segments like Ascaris, Enterobius vermicularis, tapeworm. So we can see that parts of the parasites. In microscopic examination of stool, first step is the routine examination, that is by saline wet mount and iodine wet mount. So in saline mount, procedure is take 1 drop of normal saline on slide, mix stool sample, put cover slip and see under microscope. The advantages of saline mount: useful in detection of tropozoite cyst of protozoa, eggs and larvae of helminths. Motility of tropozoites and larvae can be appreciated. Bile staining property, that is they appear golden brown, and non-bile stain eggs appear colorless. So non-bile stain eggs examples are hookworm, enterobius and H. nana, HEN. Then iodine mount, the procedure: take 1 drop of Lugons iodine on slide, mix stool sample, put cover slip and see under microscope. Advantages: the nuclear details of the protozoan cyst, helminth, eggs and larvae are better visualized. Disadvantages: iodine immobilizes and kills the parasites, so motility of the tropozoites and helminth larvae are not appreciated, and bile staining property is not appreciated. Second method is the permanent stain smears. So it is done for detection of protozoan cyst and tropozoites by staining their internal structures. The common methods are: first is the iron hematoxylin stain or trichrome stain, and modified acid fast stain. It is useful for the coccidian parasites like Cryptosporidium and Isospora. So in that 0.5% acid, that is H2SO4, is used, and that is why it is called modified acid fast stain. And these parasites are mostly opportunistic infections in the HIV patient. When eggs or larvae or parasites are very few in number, Then concentration techniques are used. So first is sedimentation method and second is flotation method. So in sedimentation method, the parasites are recovered in the sediment using either gravity or centrifugation. So the techniques used are formalin ether or formalin acetone. So stool sample and these reagents are taken in centrifuge tube, and then it is centrifuged, and then deposit is taken. In that we can find the morphology of the parasites. The advantages of sedimentation method is easy and minimal technical error is there. Morphology of eggs and cysts are preserved and it is more sensitive. The flotation techniques, stool is mixed with solution having high specific gravity, and the techniques used are saturated salt solution or zinc sulfate flotation method or sugar flotation method or saturated magnesium sulfate solution techniques. The disadvantages: some helminth eggs like trematodes, tinea, unfertilized eggs of ascaris do not float in the salt solution, and then distortion of morphology of the eggs and cyst is also there. So in this stool microscopic examination, we can see different morphological forms of the parasites. This is stool microscopic examination. So in that we can see different morphological forms. So first is cyst of Entaminma histolytica. In that we can see 4 nucleus. Then cyst of Giardia lamblia. In that we can see 4 nucleus, but the cyst is usually oval. Then tropozoite of the lamblia. So in that we can see flagellas. Then egg of H. nana. In that we can see the circular egg and it with the flagella. Then in tinea we can see it is circular usually, and we can see 3 pairs of hooklets and the transverse striations. Then egg of hookworm, in that we can see 4 blastomers. Then fertilized egg of Ascaris lumbricoides. So here you can see space between the covering, and then the center is the embryo. Unfertilized egg of Ascaris lumbricoides. So here you can see this no space and it is full of the dots and covering. Then egg of vermicularis, Enterobius vermicularis, it is mostly by one side convex and one side flat, and then here you can see in the center embryo. The egg of Trichuris trichuria, so it is usually embryo inside and then covering of double layer and 2 mucus plugs at the both ends. These are my references from we can study. I hope you find this session useful. Speaker Dr. Rajashree Mutha. Thank you.